What painkillers should you take after nail surgery? Nail surgery is typically a pretty painless procedure, and depending on what time of the day you have it done, you may not need any painkillers at all, but I'd still recommend taking some. As a general rule, whatever you take for a headache is what you should take for nail surgery, but you keep on taking it for the rest of the day that you had the procedure. So if you normally take paracetamol, and that's quite frankly normally more than enough for nail surgery, you'll be fine with just paracetamol. If you're an adult, take a full dose of paracetamol, which is 1 gram or 1000 milligrams. Most tablets come in a 500 milligram form, so you'll take 2 tablets. It doesn't really matter if you take them on an empty stomach, but it's always probably better to do so. And you want to take that dose every 4 to 6 hours for the day that you had the procedure. And as a general rule, what you'll find is that the last dose builds on the next dose. Each dose builds on the last dose. This means that the first dose you take, it has an effect, but it's not super strong. The second dose will build on the effect of the first dose, and then the third dose will build on the effects of the first and the second dose. So if you've had it done in the morning, I'd probably recommend you keep up with your dosing throughout the day, and you'll find that that's the best way to sort of keep your pain levels at bay. It's always better to keep the pain away than to try and chase it. But if you're finding that the pain is breaking through despite the paracetamol, taking ibuprofen as well can be really helpful. But if you can't take paracetamol because you're asthmatic, but if you can't take ibuprofen for various reasons, whether that's because you're pregnant or you have tummy problems or any of the other reasons that you can't really take ibuprofen, or you're asthmatic or you have tummy problems, or any of the other reasons that you can't take ibuprofen, then don't take it. Consider a different medication. If your podiatrist has done this procedure, it's likely that they can organise some codeine for you or something like that. You can buy codeine or cocodamol over the counter in most chemists if you speak to the pharmacist at the time. I think it's also available off the shelf in some shops as well too. Anyway, keep your feet up. That will stop a lot of the pain that you might get, and you'll normally find that the next morning you're not in any pain anyway. Good luck.